Hello, I'm Dr. Dennis McKenna. As always, I'm joined by Dr. Fred Venditti, our Hospital System General Director. Today is Thursday, June 18th. We're providing you the update from Albany Medical Center. So today we have a series of graphs that we're going to go through. Let's pop up the first one. The first one is one that we haven't looked at in the past. These are statewide numbers of people currently in the hospital with COVID-19. And there are currently 1,358 people in hospitals in the state. And at the high water mark, that number was 18,707. If you look at the people who are in an ICU statewide, currently 388, that number at its apex was just over 5,100.
Amazing reduction.
Amazing reduction. Let's take a look at that same number, only let's look at the capital region, the 8 counties of the capital region. Again, when you look at today, the number of people who are in the hospital being treated for COVID-19 is 42. At the high water mark in the capital region, that was 205. And in ICU beds in the capital region, we currently have 4. And at one point, that number was as high as 100.
Amazing change.
So let's look at predictors of what may be happening in the future. Again, this is a graph of the capital region. And Fred, this is looking at new cases for 100,000 people. And currently that number is 1.37. At one point that number was as high as 14.
Again, a remarkable reduction.
And what we look at, of course, is not just the number of new cases, but how many are landing in hospital beds. So let's look at that graph. These all have a very similar appearance to them. This is in the capital region, and this is new hospitalizations per 100,000. And currently we have 0.2. Again, the lowest number we've had in a while.
Absolutely.
And Fred, you'll agree with me that this aligns with what's happening here in the medical center. This will be our last graph today. This is the activity inside Albany Medical Center, where we currently have 24 people in the hospital. The breakdown is 22 on the floor, 2 in the ICU, 1 on a ventilator. And Fred, when you back out the people who are still positive but not being actively treated, 15, I think is the number.
Yeah, that's right.
So, remarkable. So that's the trend, and we continue to watch the numbers very carefully.
We absolutely are watching numbers carefully, Dennis, but they're going in the right direction.
They're going in the right direction. And we are now in phase 3, and so we're going to watch that very carefully as well.
It's going to be important to keep our eye on this.
Let's continue on the COVID theme for just a moment here. And I have 8 items that I want to go through with Dr. Venditti. I'll call it rapid fire round. So I'm going to put it out there, and Fred can give us an update on topics we've talked about many times here in the past. The first one is we celebrated our 100th day of Incident Command earlier this week. And Fred, what's the status of Incident Command?
So on that very day, Dennis, which was Tuesday, we decided to close Incident Command because of the numbers that you've seen on those graphs.
Yeah.
The decline has been remarkable.
Does that mean we're no longer focusing on COVID-19?
No, Dennis, we've just taken down Incident Command, so now we have a twice-a-week meeting where we're still monitoring and paying attention.
At one point, we said that in order to do surgeries again, elective cases, we had to have 30% capacity within the hospital to do that. Do we still have to do that?
No, Dennis, the governor lifted that requirement.
Okay. In order to have an elective procedure in the past, you used to have a COVID-19 test and be negative 3 days prior to the procedure. What's the status of that?
That's now been changed, Dennis, to 5 days prior to the procedure. A little bit more time to get that testing done.
So it may help as far as patients' schedules.
Yeah, we have patients that come from a great distance.
Yep.
There are a whole bunch of reasons why this is going to make it better.
Let's talk about therapeutics we use to treat COVID-19. One of those is an antiviral drug called remdesivir, which in the very beginning of the pandemic was difficult to get our hands on. We have used it here. Do we have enough on hand right now?
We have plenty, Dennis. We've actually gotten a number of shipments. We probably have enough to treat more than 100 patients.
Wonderful.
On hand today.
And I think Anthony Desperito and his pharmacy staff have worked very hard to get that for us.
Anthony's worked tremendously hard to get that for us. Really good.
We often will adjust the therapeutics we use to treat patients based on literature. We have a team of clinicians that look at the current literature, and there's been a recent change, I believe. Are we currently using hydroxychloroquine to treat COVID-19 anymore?
No, Dennis, we're not. As a matter of fact, recently the FDA removed their emergency exception that allowed it to be used.
We're not aware of any adverse outcomes when we use it. It's just no longer recommended.
We have not had any, but part of the reason for removing that use was because of adverse outcomes.
Right. Another thing that we've talked about, which we have demonstrated here has benefited patients, is convalescent plasma. How many patients have we given convalescent plasma to?
So we continue to use it, Dennis. We're up to 85
That's
patients. Yes, it's quite remarkable. It's made a huge difference.
Visitation. In the beginning of the pandemic, there was rare exceptions under with which people could come into the hospital. Then we were one of 16 hospitals in the state that was allowing visitation.
That's right.
What's the current status of visitation?
So the pilot was expanded. We went to 4 hours, and as of this week now, the governor has rolled that out to all hospitals across the state. So from 4 p.m. to 8 p.m. at the medical center, one visitor at a time, and with some exceptions for small children, parents, those kinds of things.
And I think another change is that in the past, if you were a visitor, you would be the only visitor ever allowed to see that patient. Now we're allowing some change.
So one person at a time, but that can be a different person on each day that there's a visitation.
Right, and I know our security team has been very helpful in that process.
And it's still required that you wear a mask.
Okay, and speaking of masks, the medical center is getting busier. How has that changed our masking rules inside the medical center?
So that's right, Dennis. We have opened up more, both in visitation and other members of the community that have come into the organization for various purposes. As a result, we've really tightened down our mask policy. So we really want people to wear masks everywhere where they're in contact with others that they can't socially distance from. All clinical areas, all public corridors, Choices Cafe, etc.
Elevators.
Elevators in particular. Closed space.
Right.
Can't really social distance there.
All right, good. Rapid fire. That was very helpful.
So I have one for you, Dennis.
Okay.
I think we have a new member of leadership. Why don't you tell us about her?
We do. We welcome Dr. Angela Antikowski, who is our new Chief Officer for Health Equity, Diversity, and Inclusion, and she serves as the Associate Dean for Student Wellness. And Fred, I think you probably want to join me in thanking Dr. Verdile, who championed this appointment, and we're certainly welcoming her to the organization in this new role. She's a clinical psychologist and has been for many years. And this is a new role for her.
New role for her in the organization. She's been a member of the organization for a while. So, yes, welcome.
Yeah, absolutely. Welcome. A couple non-COVID topics to talk about. Fred, what is the CLUE Committee? CLUE Committee.
So the CLUE Committee, it stands for Clinical Laboratory Utilization. So Dennis, you know, we have a committee and have had for a long, long time called P&T, Pharmacy and Therapeutics, where a group of clinicians talks about new medicines that we need to bring into the organizations, old medicines that we need to take off our formulary, etc. Well, we've created the same kind of committee for laboratory testing. Laboratory testing continues to morph and change and get more complicated and frankly more expensive. And there are tests that replace other tests. So from time to time we need to make changes, and we really need the insight and input of our clinicians. So Sandra Shen, the chair of pathology, and Sophie Sakaris, one of our critical care docs, are the co-chairs of this committee, and they've begun to look at the testing that we do and make recommendations to the medical staff about what we should add, what we should subtract, and how we should comport ourselves.
It's a great and a very important committee, for sure.
Very important committee, and already Dennis, just after a couple of months, has made some really significant recommendations that have been accepted.
Great. Last topic is the survey on COVID-19, the Albany Medical Center response. I think we've received a robust number of survey results.
We've actually had 900 members of our staff respond, so that's 1 in 10.
Yep.
It's still open. We want to hear from you. We'd encourage you to go online and fill it out. It's a lot of free text, so you get to really tell us what you think about how we handled the COVID pandemic here at the medical center. We'll close it out probably the beginning of next week, and then we'll talk more about it at one of our videos probably next week.
Wonderful. All right. So a lot of good news here on the medical campus today. Obviously, great numbers when it comes to COVID-19.
Absolutely.
A lot of great activity in non-COVID areas, and obviously the appointment of Dr. Antikowski, so which we really appreciate her leadership in that role.
Yes.
Wonderful.
Now, to your point about non-COVID activities, the hospital has gotten busy again.
Yes. For sure, for sure.
Good work being done in our emergency department and the operating theaters across the whole house.
For sure. All right. Well, our normal routine is Tuesdays and Thursdays, so we'll be back again on Tuesday, and we'll see you then. We ask, of course, that you please take care of yourself, take care of each other, and we'll see you next week.